Hello, Dr. Vikram.
Hello.
I welcome you to this deep jungle,
Yeah, it is very deep.
and I'm glad to see that you are visiting jungles to find out new herbs, and you are a very dedicated Ayurvedic physician.
Thank you for that.
And
In the forest, we get so many herbs, so many medicinal plants. In the lap of Mother Nature, they are growing. Mother Nature tells you that she is here to heal you. So there is nothing to worry. Your problems can be solved.
yes, and I see you with coconut in your hand, and
This is a packed mineral water sent by God.
yes, I can see that you are standing just under a beautiful coconut tree, and there are beautiful coconuts,
Yeah.
fresh coconuts growing.
Yeah. It has a healing power. In Ayurveda, it is mentioned that coconut is cooling in nature. It is full of natural nutrition, so it is not heavy for the body. So one who is suffering from any Vata and Pitta disorders, he can drink this water.
So, Dr. Vikram, today I would like to know that what exactly do you recommend for the ulcerative colitis patients? Because many people, they are not only taking medicines, also they are using herbs, but still they have a lot of inhibitions about what to take in their regular diet and what to avoid. So, please guide us that what kind of diet a ulcerative colitis patient should follow.
Ulcerative colitis is a tri-doshic imbalance disease in which there is imbalance of all three doshas, Vata, Pitta and Kapha, plus there is ama, too much accumulation of ama. So it is not only sangrahni, it is amaj, amjanya, rakt, pit, atisar. So patient complains of bloody stools, patient complains of pain, abdominal cramps, gas and bloating, and going to toilet for about 10 to 20 times, and there is pain in the, especially in the left side of the stomach, of the abdomen, and there is mucus along with the mucus and blood along with the stools. So there are so many Ayurvedic herbs plus the diet which should be taken to get rid of this problem. It is curable in Ayurveda with difficulty. One has to take the Ayurvedic medicines regularly for about 6 months to 9 months and maybe up to 1.5 years. But it is possible to bring the patient into remission within few weeks, within few months, within 2-3 months into the remission, and then if continuously taken Ayurvedic treatment and diet, then it can be cured also. So I have many patients which are not taking any Ayurvedic medicines or allopathy medicines. They are completely okay now from last so many years. So not only herbal herbs are important, but diet is also very important. So this video I have dedicated to all my patients who want to know which diet they should follow. Pomegranate juice I recommend to everybody. Little quantity, not too much. Fresh pomegranate, not the packaged one. All the packaged juices they should not consume. Only pomegranate juice, fresh ones. They can even boil the pomegranate peel, the outer cover of the pomegranate, and then drink the decoction, the water of the like pomegranate tea. So pomegranate juice, they cannot swallow the seeds. Just crush the seeds, just take out the juice and drink 50 ml every day. Yogurt is good for so many patients. Plain yogurt, not flavored, not with fruits, nothing, just plain yogurt. It is full of natural enzymes and bacteria which are good for the gut. Most of the patient, 95%, 99% of patients, they feel better with the yogurt. Along with banana. If they add banana into yogurt and then they consume it regularly, they feel much better, and they feel the consistency of the stool is better, and there is no bleeding, and they digest the yogurt and banana combination very well. Milk is very bad for colitis patients and IBD patients. Milk and other milk products like most of the Ayurvedic Vaidyas, they recommend takra or lassi or chach or buttermilk, which I have seen it is in many patients it is worsening the symptoms. It is not suitable for about 80-90% of the patients. So I don't recommend this chach and takkar, because chach and takkar is very good for sangrani. This is not sangrani, this is ulcerative colitis. It has different signs and symptoms. It is amjanya, rakt pitta tisar. So it is the lassi or the chach or buttermilk doesn't suit most of the patients. So I don't recommend. In case of gas and bloating patients, they can consume decoction of cumin seed, fennel, and thyme. It's in simple Hindi language. It is called jeera, saunf, and ajwain. Or coriander can also be added. Just boil these four herbs: jeera, saunf, ajwain, and coriander, cumin, thyme, and fennel and coriander. So boil these four herbs and then take decoction like a tea. So this can be taken. Khichdi is very good for colitis patients. Khichdi is prepared with rice and very dilute form of with too much of water. And the other one, you add some yogurt in khichdi, and also moong dal is very good because patients they feel weak, and moong dal is full of protein. So moong dal can be given. Potatoes, boiled potatoes are very good. Boiled potatoes, they give energy to the body. They are full of vitamins and nutrition and carbohydrates. So to gain weight, boiled potatoes are okay. Sugar beet is also good because sugar beet is good in calories and vitamin A. So it is good for the body. And anything else you want to ask?
And what about the intake of, because lot of ulcerative colitis patients, they are losing weight and there is muscle loss. So what do you have to say about cow ghee?
Yeah, ghee is very soothing for the ulcers. So ghee is very good. So it can be consumed 1 spoon morning, 1 spoon evening. Arjuna is a plant which is very good for the ulcers. So I'm usually recommending Arjun ghee also. Shatavari is also very good healing plant. Licorice is very good healing plant. So ghee along with all these herbs, or maybe within the khichdi, can be given every day.
And what all herbs do you recommend normally for the ulcerative colitis patients?
For colitis patients, I recommend this Arjuna Kutaj. Kutaj is wonderful. It is cooling, it is soothing, it is astringent, it heals wounds, and immediately within 1 week you see the results. So Kutaj, I recommend Kutaj Ghanvati, I recommend Motion Stop, I recommend Coolstrin AB. Coolstrin AB is containing, my Musa pudica, there is a herb called Lajwanti or Chui Mui. When you touch the plant, it shrinks, it shrugs away, so it shies away. So that's why the name is Lajwanti. So Lajwanti is Mimosa pudica in Latin. So I'm using the capsule made from that plant, Mimosa pudica. It is astringent, it heals the wounds and stops the bleeding from the colon. And Arjuna is also very cooling. I'm using marigold flower petals extract in Coolstrin B. I'm using this, what do you call that, all other herbs which are cooling in nature. This coconut water, every day you should drink. Fresh one is better, not the packaged one. If you don't have fresh one, it's okay. Just consume this pomegranate juice. That is what.
And Dr. Vikram, we have seen that lot of young children are these days facing problem of ulcerative colitis, like in the age group of 7 and 10. We have patients because it has been seen that maybe they are taking too much of junk food, too much of chocolates and cheese. So what do you suggest for that age group?
In my opinion, this packaged milk and milk products, especially cheese, is a main problem, and also the cold drinks, soft drinks, and junk food. So because cheese contains so many the proteins like casein and other proteins, which are like allergens to the body, antigens, and the body makes antibodies against them, and such proteins are not digested in the body, and then the body makes antibodies, and then the antibodies attack the colon, and then the colon, it is called autoimmune disorder, this ulcerative colitis. So I would recommend to stop all this junk food. Any food which is made by God is good for our body in general. Any food which is made by man is not good. So this is made by God. This is packaged mineral water, I would say. So this is very cooling. And other than this, anything which is growing in nature. There is a wonderful fruit called bale. Bale is Aegle marmelos, the Latin name. So Aegle marmelos, bale, the fruit part is good. not the leaves. Most of the people, they consume Bilvadi Churna. Most of the Vaidyas in Ayurveda, they recommend Bilvadi Churna. Bilvadi Churna contains bale leaves. Bale leaves are good for diabetes, not for ulcerative colitis. They have different properties. Bale giri is bale fruit, the seed of the bale fruit. So bale fruit seed powder is good for colitis. It is healing. So curcumin, I'm coming to curcumin also because that is very important. Most of the modern medical doctors are now recommending curcumin, turmeric, for healing ulcerative colitis. In my opinion, in my experience, turmeric is not doing that good because in Ayurveda it is drying and it is full of Pitta. It is hot in nature. So when you give something hot, spices and hot like chilies and turmeric and ginger and such spices, sometimes they can cause burning, they can cause acidity, and they can cause more bleeding. So
Aggravate.
you have to be very careful while using curcumin. If the bleeding is not there, and if there is more gas and bloating, if there is more mucus, then you can use little bit of curcumin, little bit of ginger, little bit of hing, asafoetida. So such spices, they should be used very carefully in patients of IBD and ulcerative colitis. So if you don't know where to use them, it's better not to use them.
Okay. Thank you, Dr. Vikram. It was really nice talking to you.
Yeah, and I want to tell all ulcerative colitis patients that there is nothing to worry. It is possible to get rid of the problem. I have so many patients in which I have stopped all the allopathy medicine as well as the Ayurvedic medicine. And now they are living free from the disease from last so many years, and they are happy about it.
Okay. Thank you, Dr. Vikram. Thank you so much. And I am sure you are finding out more new herbs and roaming around in the jungle to help all your patients.
Thank you.
Thank you.
Thank you.